In Chapter 16, Segment 4, there are several types of anxiety disorders. It says that some people experience apprehension and fearfulness with an intensity that is overwhelming and includes irrational fears, a sense of terror, unusual body sensations such as dizziness, difficulty breathing, trembling, shaking, and a feeling of loss of control. It also says that anxiety can be lethal, and a follow-up of patients with panic disorders revealed an increased mortality in men with this disorder resulting from cardiovascular disease and suicide. Anxiety disorder is any class of psychological disorders that include recurrent panic states and generalized anxiety disorders. This includes generalized anxiety disorder, in which persistent and excessive anxiety and worry are experienced for months, and it also includes panic disorder, where people have more recurrent transient attacks of fearfulness. Some people who suffer from this have temporal lobe abnormalities, and overall temporal lobe volumes tend to be lower in patients with panic disorder, but hippocampal volumes are normal. Phobic disorders are an intense, irrational fear that becomes centered on a specific object, activity, or situation that a person feels compelled to avoid. Because the amygdala plays a role in mediating fear, changes in the amygdala and associated circuitry may underlie the symptoms. There is a strong genetic contribution to post-traumatic stress disorder and obsessive-compulsive disorder. In Drug Treatment of Anxiety provides clues to the mechanisms of this disorder and says that people have consumed all kinds of substances in the hopes of controlling anxiety. Benzodiazepines are a class of anti-anxiety drugs that bind with affinity to receptor molecules in the central nervous system. The most common example is diazepam, PAM, or Valium. Others include Xanax, Halcion, and Ativan. These drugs are so widely used that they can be detected in lakes and streams at concentrations that have been demonstrated to inhibit social behaviors in fish. Anxiolytics are a class of substances that are used to combat anxiety. Examples are alcohol, opiates, barbiturates, and the benzodiazepines. Anxiolytic benzodiazepines bind to GABA receptors, where they act as non-competitive agonists. This results in the enhancement of GABA's action at inhibitory synapses in the brain. They preferentially bind to the GABAA receptors that are widely distributed throughout the brain, especially in the cerebral cortex and some subcortical areas such as the hippocampus and the amygdala. The ultimate function of the benzodiazepine GABAA receptor complex is to regulate the permeability of neuronal membrane to chloride ions. When it is released from a presynaptic terminal and activates postsynaptic receptors, chloride ions are creating a local hyperpolarization, which is inhibiting the neuron from firing. Benzodiazepines alone do little to change chlorine conductance, but in the presence of GABA, they markedly enhance GABA, provoke increases in chloride permeability, and potentially the inhibitory effect of GABA. The brain probably makes its own anxiety-relieving substances that interact with the benzodiazepine binding site. Allopregnanolone is a prime candidate for this function. Drugs developed to act at the site are effective anxiolytics in both rats and humans. Other types of anxiety-relieving drugs have been developed. Buspar is an agonist that has been shown to provide relief from anxiety. It is at serotonin 5-HT1A. This receptor density is abnormal in anxiety disorders. SSRI antidepressants such as Paxil and Prozac, which increase stimulation of serotonin receptors, are also sometimes effective treatments for anxiety disorders. In post-traumatic stress disorder, horrible memories won't go away. It says that some people experience especially awful moments in life that seem indelible, resulting in vivid impressions that persist the rest of their lives. Memories of horrible events intrude into consciousness and provide the same intense visceral arousal, the fear and trembling, and general autonomic activation that the original event caused. These situations can be easily awakened by stressful circumstances and even by seemingly benign stimuli that somehow prompt recollection of the original event. Post-traumatic stress disorder, formerly called combat fatigue, war neurosis, or shell shock, is a disorder where memories of an unpleasant episode repeatedly plague the victim. 19% of Vietnam victims had PTSD at some point in their lives after service. Of those exposed to high levels of war zone stressors, more than 35 developed PTSD at some point and still suffering decades later. Familiar factors affect vulnerability, as shown in twin studies of Vietnam veterans who had seen combat. Monozygotic twins were more similar than dizygotic twins, and the specific contribution of inheritance to PTSD may account for 1/3 of the variants. People who display combat-related PTSD show memory changes such as amnesia, first or more experiences, flashbacks, and deficits in short-term memory. These memory disturbances suggest involvement of the hippocampus, and it was proven that the volume of the hippocampus is smaller in combat veterans with PTSD than in controls with no other differences in other brain regions. An inherited tendency to have a small hippocampus and lower rats of adult neurogenesis may be what makes a person more susceptible to PTSD if exposed to stress. Fear conditioning is a form of learning in which fear comes to be associated with a previously neutral stimulus. The persistence of memory and fear in PTSD may depend on the failure to forget. NMDA antagonists delivered to the amygdala prevent the extinction of fear-mediated startle. Sites projecting to the amygdala, such as the hippocampus and prefrontal cortex, may lose their effectiveness in suppressing learned fear responses. There is also a hormonal link because PTSD sufferers exhibit a paradoxical long-term reduction in the cortisol levels. Patients with PTSD have persistent increases in sensitivity to cortisol. They feel the effect of stress hormones more strongly than other people do, and this might make it harder for them to forget stressful events. The most effective treatment for PTSD is cognitive behavioral therapy involving prolonged exposure, gradually increasing the client's exposure to those stimuli, and conditions that trigger flashbacks until they no longer have responses. In obsessive-compulsive disorder, thoughts and acts keep repeating. It defines obsessive-compulsive disorder, or OCD, as a syndrome in which the affected individual engages in recurring repetitive acts that are carried out without rhyme, reason, or the ability to stop. Routine acts that people engage in become compulsions or acts that are repeated over and over again in people diagnosed with OCD. Recurrent thoughts or obsessions, such as fear of germs or other potential harm to the world, invade the consciousness. These symptoms progressively isolate a person from ordinary social engagement in the world. It is estimated that nearly 1% of adults will suffer from severe OCD in the United States. The initial symptoms of this disorder appear in childhood, but the peak age group for onset of OCD is 25 to 44 years old. Patients with OCD display increased metabolic rates in the orbital frontal cortex, cingulate cortex, and caudate nuclei. OCD responds to treatment in most cases. Some treatment includes CBT and several other drugs. Prozac, Luvox, and anafranil share the ability to inhibit the reuptake of serotonin at serotonergic synapses, increasing the synaptic ability of serotonin. This suggests that the dysfunction of serotonergic neurotransmission plays a central role in OCD. Depression often accompanies OCD, so the two disorders may be related. SSRI drugs alter the activity of the orbital frontal precortex, in which people with OCD, and also affect primarily ventrolateral prefrontal cortex in people with depression. About 1/3 of severely disabled OCD patients who underwent cingulotomy appear to benefit from this intervention. Cingulotomy is a surgical disruption of circuits in the cingular cortex. A similar surgery, making small discrete lesions in the anterior part of the internal capsule, may be beneficial in some cases of severe anxiety disorder, but the patients were also more likely to suffer from apathy, a common symptom of lobotomy. Overactivity of a circuit from the prefrontal cortex to the striatum to the thalamus and back to the cortex may underlie OCD. Induced overactivity of this circuit in mice resulted in prolonged stereotyped grooming behavior that was relieved by SSRI treatment. Deep brain stimulus of the nucleus accumbens in people suffering from OCD disrupted the same circuit and relieved symptoms.